Okay, what about diabetes? Well, in the olden days, we thought that weight loss surgery was kind of good for diabetes because you lost weight. Okay? But if you had a choice, you could lose weight with weight loss surgery, or you could lose weight and get rid of your diabetes just by willpower alone. And if I asked you which was a better way, you would probably say it would be better to do it with diet and exercise, correct? So some French guys, some French researchers got together and they wanted to answer that question. Which is a better solution for diabetes? Just having a diabetic mouse go on a diet, or having a diabetic mouse have a gastric bypass? So the French researchers took diabetic obese mice and did a gastric bypass. So you have to respect them, right? That's a tough job. They did gastric bypasses on obese diabetic mice. Then they watched them lose weight every week, and they kept the diet of the other mice in the control group such that they lost the same amount of weight. Whose diabetes got better? The surgery mice. Why? They had the same amount of weight loss. It turns out that the upper small intestine, where the pancreas and the gallbladder and the liver all live, is really important because the pancreas is where your insulin comes from. And when you bypass that upper small bowel, stuff happens. Hormonal changes occur that may actually cure diabetes. Remember a minute ago we were talking about how bypassing affects ghrelin and peptide YY. Well, there are two other major insulin hormones, glucagon-like peptide 1, GLP-1, and gastrointestinal peptide, or GIP. So I like to say this, GLP and GIP. And they are both what are called part of the incretin system. That's part of the body's ability to control sugar. And when you do a bypass, GLP and GIP go up, and we may see a cure of diabetes in type 2 diabetics. More powerful than just weight loss alone, because you don't get the same powerful impact from, say, a lap band. A lap band, like weight loss, does help, but it doesn't improve the GLP and the GIP. Plus, to even go into more detail, maybe more detail than you really want, you may know that insulin comes from what's called the beta cells in the pancreas. Have you heard that? The beta cells in the pancreas actually hypertrophy. They grow in response to the bypass. And that doesn't happen just by weight loss alone. So, gastric bypass, we are now on the threshold of saying, may actually cure diabetes.
Do you have to exercise with the bypass?